Jacko here, and I'm very pleased and lucky to be able to introduce to you a great friend of mine and a doctor that I've been working closely with to help her and her patients with improving their overall health, how they manage stress and anxiety, and so much more through using the power of the breath and teaching correct functional breathing patterns as per the principles of the Oxygen Advantage that I, as a master instructor with the Oxygen Advantage, love to teach. And there is some absolute gold in here in this conversation with Dr. Sally Bell. And it is going to hopefully give you a good insight into how improving your breathing, some practical tips of ways that you can do it in your day-to-day breathing lives, not having to set aside 30 minutes to do a breathwork session. Now, how do you change your breathing for your day-to-day lives and breathing habits, making breathwork part of your normal daily activities, increasing your awareness and knowing what it is that you're trying to do. And Sally gives us great insight into some of the mechanisms behind how this is going to help improve all aspects of your overall health and well-being. So I hope you enjoy it. If you haven't yet subscribed to my YouTube channel, hit subscribe wherever it is. And I look forward to hearing what you think in the comments. Let us know in the comments what you think of the video, how potentially changing and thinking about your breathing has improved your overall health, and any things that you're noticing with your breathing. I would love to hear from you on them. So do pop them in the comments. And thank you for watching. Here is me with Dr. Sally Bell. So, Dr. Sally Bell, why don't you give us give those watching and listening a little bit of background as to how we got working together and what are some of the effects that we're seeing on patients and clients' health by helping them improve their breathing.
Yeah, so it's great to be with you again, Jacko. Always love chatting, and we've actually known each other probably for about 10 years. You actually trained me back then, and over the last sort of year we've started working together and using breath work as one of the tools to help people recover their health. So my approach to medicine is a little bit different to conventional medicine. You know, I've been a GP 22 years, but halfway through my career just got really tired of treating diseases, not people. You know, looking at a part, not looking at the whole, you know, and taking people out of the context of their communities and their families. And so sort of went back to the books and kind of asked myself, like, what does our body need to thrive? Like, you know, we're genetically wired for healing, for getting rid of cancer cells, for keeping our mood stable, you know, for keeping inflammation down and our sugars stable. You know, what is it our bodies need? And it's kind of, that's been the approach that I've taken over the last 10 years. And I talk about 5 foundations originally. I would talk about sleep and movement, rest, connection to self, others, and nature, and also about nutrition and what we're eating. But over the last few years, I've become increasingly...
Is breath becoming its own pillar?
It is totally. So I think over the last 3 years, you know, through our discussions, I think initially you were the person that introduced me to the idea of the importance of breath work, and having followed, you know, some of the Oxygen Advantage teaching and have experienced the benefits in my own life. And I started introducing it to, you know, some of my patients and starting to see improvements in all sort of aspects, you know, not just, you know, because sometimes you just think, oh, it's just for calming down, but it's not. It was about hormonal balance, gut health, all sorts, and realized I couldn't really teach it or didn't have the time to teach it. So that's when we got talking, and now you've been working with some of my patients, again, a real range of symptoms and problems, and I have been totally bowled over by the impact of getting breath work right on many aspects of people's health. And it's such a no harm, you know, approach, you know, unlike a drug that I might throw at somebody with all its risks, like breathing, you know, doesn't have that risk. And then I think I've just been totally bowled over by the science as that's come to light over recent years of what breathing does, like at those root causes, you know, upstream in our body, you know, to our inflammation, to, you know, our gut function, to, you know, our hormones, and just phenomenal, even our perception of pain, and how our breathing and diaphragm holds the body together physically. So that impact on, you know, back pain and pelvic pain. So it's just been a joy you know, it's been great having you as part of the team, being able to guide people back to health. But I mean, what's your experience? You know, you've come from that sort of more elite sort of athletic background, and now you're working with a range of my patients. What's your experience, David?
Yeah, well, I was gonna say I take zero credit. Like Patrick McKeown, you mentioned with the oxygen mask, he is who introduced me to the effects of breathing on. I guess initially I got excited by the physical improvements, but equally for me there was an issue around a head injury that I sustained back in 2013 that disrupted my breathing, that I was completely unaware of and had no rehabilitation for. The specialists and the doctors that I'd seen, you know, it just wasn't something that was that we knew. We knew about all of my symptoms, and then it was like long ongoing. Okay, you seem fine now, but there was still something inherently in the background going on. The way I describe it to people is like, you know, you've got your handbrake slightly on in the car and you go to pull out of the car park, but you forget the handbrake slightly on. And you haven't got one of them fancy cars that's got flashing lights and beeping to stay the handbrakes on. You're like, I've got an old camper van that just, you could even have it on, and it just feels like something's just not right. You're just not firing all cylinders. Patrick McKeown has been doing some amazing work within understanding and bringing the research to light in the last sort of 20 years, and so it's just been life-changing for me, and I just feel very privileged to be able to use some coaching skills to be able to help get that across to other people that need it the same.
And it's interesting, like you use that life-changing, because that, you know, I'm not a quick fix doctor, and it's complex. We need to work at all those foundations. But I will often hear back from my patients, like, it was a game changer. You gave my life back to me. You know, it really, people are a bit skeptical sometimes, aren't they, when they begin? But it is not an uncommon phrase that I would hear when we talk about teaching people just breathing correctly.
I don't use that.
That's having.
And I wouldn't say that and use that lightly. And at the same time, it isn't a quick fix, but there will be, and I would love to give us to be able to give some people that are watching this and listening, you know, some experience of it, some practical stuff, is to go like in the immediate, you will notice and feel some change. And it'd be really great to talk also about you know, some of the mechanisms that's actually going on, like, so physiologically, what is happening and why are we then actually feeling better. But it's not then like tick a box, it's fixed. Oh, I've completed breathing because I did a session with Jacko, or Sally's introduced me to some of these concepts. It's like, it's almost like the seed that then like kicks it off and go, and it's, you know, the opportunity. We're breathing all the time until we take our last breath, which is hopefully in many years, and there's the opportunity to do it better, and there's a good reason why we should be seeking better control of our breath, because it's going to help us. And we'll talk, and you know, Sally will talk about some of the science, the mechanisms behind them. So people I always like to help when I'm working with anyone, to help them understand at whatever level of like the science they want to go into, but having some level of understanding of how and why this is working, so then you're going to be encouraged to implement it in. And just to say, there's one patient springs to mind that after the first session, he was like, I said, you know, come back and it's the second session, so how's it been? He was like, wow, it's been pretty incredible. I go, you know, it was quite, and I was like, okay, that's good. You know, and I'm a very simple guy in that, like, if I get some positive feedback, I'm like absolutely buzzing. So I'm like, okay. He seemed to be enjoying it at first, but a little bit sort of unsure. And he said, if I'm being really honest with you, Jacko, and I felt that, and that in itself was a good sign. That I was like, right, we've spent 1 hour together via Zoom, not even in the same place, and he's now feeling like he can be honest enough to, and literally said, when Dr. Sally said she was going to refer me on to do some breathing exercises with a breath coach, he was like, I thought, what is that going to do? Like, I breathe, everyone breathes. It's just something that happens automatically. And I think this is one, and that is true. We breathe automatically. The body is this amazing thing that is, will keep you alive no matter what. Just because you're doing it automatically doesn't mean you haven't got into some bad habits, and dysfunctional breathing is all too common for a host of different reasons. But the stresses that are in our modern day lives are probably a little bit different to how it has been. And it doesn't mean that we haven't got ways to cope with that. We have, and the breath is a very fantastic free tool to be able to use our breath to change our stress response, our physiology. But unaware of that, you can be in a place where you're like, what's this going to do for me, or just thinking there isn't any place for it. And he said after that session, just the concept, really interestingly, the big thing for him initially was, or two things. I always say to people, awareness is key at the start, so people can think about this already, like how it, just because the fact that you're listening to this conversation, you'll start thinking about your breathing. So it's like, ask yourself now, how are you breathing? Ask yourself that question. Also feel it. Where are you breathing? So awareness is key, and we highlighted something for him that he started to become then really aware of after the first session, was that there were these big sighs or yawns every, like, I don't know, 5 minutes or so. So I noticed that. I'm looking out for them, so it was easy for me to, I know that's something to look out for. And it's this getting rid of this CO2. It's a sign that the brain's not happy with our current breathing rates, and it's like, okay, reset. Get rid of this carbon dioxide, which actually we don't want to become too sensitive to carbon dioxide. And the thing that we then suggest to do is like pause at the end of that exhale, just to allow that CO2 to build up, in terms of then not becoming too sensitive to it. So that was in terms of like the physiology. I'm like, oh, we're getting rid. I'm noticing you're a bit sensitive to CO2. You're getting rid of that CO2 with these common sighs within your speech. And so, or just within your demeanor. So we're going to put a pause in there. And actually, he taught me something through this, actually, which I learned something from the patients all the time, which I love about it as well. They don't realize they're teaching me. But I knew that was important for his CO2 tolerance, because what that's going to do for his general breathing habits and that stimulus to breathe, or primary stimulus to breathe. But that pause we said you want to do for like 3, 4, 5 seconds, just gave him like a timeout. And he was like, the pause and just nothing happening. It was like, I just love those few seconds. And I'm going, oh, great, because you're like mentally getting something different out of this that I wasn't even thinking about. But I know also we're doing something to address your CO2 tolerance. So that was a nice.
No, it is. And I saw him in clinic just this week, and compared to the man that I saw when he came into my clinic, his whole demeanor had changed, shoulders down, talking, really calmly, really breathing properly. It was a beautiful moment just watching him. And I think we can talk a little bit about mechanisms, but I think what I think is really important as well, to help people understand why it's so important, because I'm not sure I said this, is when you look at sort of chronic disease that we're struggling with as a nation. And chronic disease, I mean everything from your heart disease, your cancers, your diabetes, obesity, all of these diseases, mental health issues, hormonal issues. Like when you look under the hood of what's causing it, 10% genetic, and like 90% in some cases is lifestyle. And lifestyle problems require lifestyle solutions, and this idea to keep medicating is just barbaric, and it is illogical. And actually what we need to do is live by design, slowing down, and those foundations I talked about, sleep, rest, movement, connection, and nutrition, that's all great, but sometimes to actually make those changes is really hard. And I think what's amazing about breath work is it's so accessible. It's something that we can all do for 10 minutes. How you teach it, I love the fact that we can measure things like our BOLT score, and we can see ourselves progress, and we'll talk about that in a minute. But sometimes actually starting there is the most helpful thing, because it will improve sleep, it will help your gut function so that you can actually absorb your nutrition, it will help you put yourself in a position where you can make better decisions because you're not in that stress zone. You know, it's calming down inflammation. It is changing your perception of pain. And then you're in a better place, you know, just through some of these simple tools that you're giving and teaching people to breathe properly. You're then in a better place to make decisions about how you move, to reconnect with people that you've lost touch with, to reconnect with yourself, you know, to think about purpose, to make good decisions around your nutrition. And so I think that's why I'm so impassioned by it, because it's all very well telling somebody how to eat and how to sleep, but often they know what they need to do, but they don't have the tools to because they're overwhelmed and their body is overwhelmed. And breath work is a route to bringing balance, which we can then build on those other foundations, which when we just move more and more towards flourishing and health and further away, you know, from disease. So let's talk about, you know, the mechanics of you know, what you're teaching and some of, you know, some of what's going on in the background in our body. I think you're better to speak about this than me, Jacko.
Well, I think it was to talk about some of the mechanisms, what are going on, and then let's get into a bit of detail about what we can actually do. And I think we both have got something to share in terms of how we think these, or what the science and research is saying, of how these mechanisms are affecting our physiology. And just as just something that I wanted to add on to that part about, like, being aware of our breathing on the day to day, like, you know, moment by moment is a key part to it for me, in particular the way I approach it and try to teach it, because I'm interested in trying to change your daily breathing habits. So I'm interested in trying to make breathwork a normal part of your day. So I'm not seeing it as like a training session where I'm going to do 30 minutes of breathwork, tick, I'll go and crack on with the rest of my day. It's no, I don't actually want you to ever do like a section of time. Potentially, I want you to be at the point where you're able to be aware of and manage your breathing and notice it in different scenarios, different postures, physically as well as emotionally, when different things are going on, so that you've then got it as a tool that you're able to manage throughout the day. Because and going into mechanisms, because the thing that's governing how you breathe and that feeling of like, oh, it's just happening automatically, is the brain. And the respiratory center in the brain stem is monitoring 24/7 all the time, like what is, and one of the main things it's monitoring is levels of carbon dioxide in the body. Hence why we said about that climate that was doing sighing quite a lot, which is quite common for people that are struggling with sort of stress and anxiety, because we get too sensitive to carbon dioxide and we get used to breathing it out too much. So that could be in regular sighing or yawning, or just generally breathing too much. So breathing more than our over breathing being defined as like breathing greater than our metabolic demands. And that's the issue, is not necessarily like the air coming in or you're not getting air in. It's about what goes on the exhale. And on the exhale, we're breathing out. It's not 100% oxygen coming in and 100% CO2 going out, but we are breathing out more carbon dioxide than we want to, or the body needs to. And then we become more sensitive to carbon dioxide because we have lower levels of it within the body, and therefore the tolerance levels of the chemoreceptors in the brainstem that are monitoring CO2 become more sensitive, and therefore then triggering this snowball effect of like triggering you automatically to breathe faster. So one of the measurements that a couple of measurements used, one was that the BOLT score, which is probably a little bit more complicated. It's called the control pause and Buteyko method as well. Same thing, where we're measuring how long it takes after a normal exhale for during a breath hold, where you're not using your willpower to hold your breath. You're just letting that CO2 levels rise in the body, and then you breathe in when you feel the urge, the first definite desire to breathe. And often, and I was exactly the same as this, you think that first desire to breathe is based on, oh, the oxygen's gone down because I'm not breathing in, therefore like I need to breathe oxygen in, but it's not. The trigger to breathe because of oxygen being low only apparently happens when our blood oxygen saturation, our SpO2, goes down below 60%, which is like ridiculously low and you're about to pass out. So it's that carbon dioxide levels is rising. Just understanding That's my trigger for breathing, and why over breathing is bad, because it's going to make me carry on breathing faster. Is just a really good starting point of just getting that sort of relationship of how your breathing is automatic, then also then how I need to start to think about controlling it. Because if breathing too fast is not good for me, then I know that the opposite of that, you don't have to be a breath coach to work out that the opposite of breathing fast is breathing slower, right? And so that's one of the things. And I think in terms of then mechanism, great to get your insight on this, of why breathing too fast isn't good for the body in terms of that heightened level of like stress, which is linked to the sympathetic nervous system, and how that affects inflammation, and then how that's going to affect all other aspects and automatic process or autonomic processes that are going on within the body. Because something the way I've tried to explain it to a lot of the patients that I've worked with of yours is going, right, your current breathing rate is, say, like 18 breaths per minute. So that's the other method of the thing to measure. Just set a stopwatch, time yourself for a minute, count, don't try to change breathing, just count how many breaths do you take in a minute automatically when you're not in control of it. What's that habit of respiratory rate that you've got? And we want it to be around 10. So when it's like, if it's 15, well, you might go, it's only 15, it's only a little bit more than 10, but it's 50% more. If it's 20, and if I'm breathing at 10 breaths per minute and you're breathing at 20, your system is working twice as hard as mine in the background. So what I try to explain, just bringing the overall system just down a few pegs. So when we're breathing faster, there's a relationship with the heartbeat and the autonomic nervous system. So everything's having to work a little bit harder. And that stress bucket is just getting it filled up a little bit, or starting at a fuller point. Can we bring the overall system down? And the breath is the easiest probably way to, rather than just, can you just slow your heartbeat down for me? It's like, that's harder to do, and the breath will do that. Can you just calm your central nervous system down? Like, how do I do that? And the breathing is a great part of that. So,
I mean, from a medical perspective, the key, because I want to also talk about the diaphragm, but I think what's really, really important to understand is, as you said, we use some big words there, but you talked about the parasympathetic and the sympathetic nervous system, and so really they're always working together. There's never just one switched on and then the other switched on. They're kind of bringing this balance, and the body overall wants you to thrive and flourish. It's looking at bringing harmony in your body to all of your systems, and it uses these kind of brakes and accelerators, through these nervous systems to bring that balance, in your body. Now, sometimes you need some stress to get a job done or run away from the lion, and therefore it will rev up. It will impact all aspects of your body, raise your blood pressure, raise your heart rate, make you hyper alert, get the blood flow to your muscles, get it away from your stomach and digestion. You don't need your immunity at the moment. You need to run, you need to increase your clotting. So it revs it up so you can get, you're safe. And then what would naturally happen historically is that it then revs down and your body goes back to this balance. And balance is totally, totally essential for our human flourishing. It is the place where all of our functions work, our rest and repair, our growth, our nutrition, our gut function, our brain function. They all operate best when we have balance here. And so it's never one or the other. It's that balance that the body is trying to find. And sadly, what we're seeing, in society and in modern life, and the WHO, the World Health Organization, has said stress is a pandemic. It's a global pandemic, way before COVID. And the reason that it's so concerning is that if our system is constantly revved up, what does it do? It raises sugars. Oh, we have a problem with diabetes. It raises blood pressure. Oh, we have, a real problem and a crisis with blood pressure and heart disease. It increases inflammation. Oh, that's at the root of dementia, obesity, heart disease, rheumatoid, go on and on. Oh, it shuts down blood flow to your gut. Oh, we have this massive problem where everybody is bloated and they've got bellyache and they don't feel like they're digesting right. It impacts our energy. all of us are tired, impacts our memory. How many of us are struggling to access, our short-term memory? Impacts our heart rate. How many of us are having, palpitations? And, and then it also shuts off those natural repair to our DNA. And, and so I think and that's why breath, like you say, what it does is it helps reset the system. And that's why it's so key when we're thinking of any aspect of health. It is an amazing tool for resetting that. Now, how it does that in terms of carbon dioxide and the impact on the different nerve system and on the brain and the sensitivity around carbon dioxide, and it's fascinating, but I don't think we need to understand that. What we need to understand that it's our body desperately needs balance, and the route to it, one of the routes to it, well, probably one of the routes to it is, is using breath work.
One very simple element that ties in how you mentioned about heart rate, blood pressure, nervous system. If we think of, we've got those two arms of the nervous system, fight or flight, sympathetic and parasympathetic, that rest, digest, that on our inhales, how our breath is integrated into this. On our inhales, every inhale you take speeds up the heartbeat and is a more sympathetic dominant. Every exhale we do can help slow down the heartbeat and be more parasympathetic, relaxing. So when you're talking about that balance, every breath people are taking, this is happening with every heartbeat that we're taking. We don't need to necessarily go into it. Heart rate variability, again, another marker people can use to measure things. A lot of people have these Whoop bands or Oura rings that will measure these types of things. Yeah. And you'll notice that when you practice some slower, lighter breathing, we can go through the detail of how we put that into place. But generally, that slowing down of our breathing and thinking about our exhales, we get to work on switching a little bit more away from the stress and into that relaxation to get some of those.
And I want to also interject there, because I think one of the things that often doesn't get talked about is pain and perception of pain. And it's very clear, from the research that what we're doing with our carbon dioxide. So you talked about, retaining too much carbon dioxide or blowing it off, that actually, impacts our perception of pain. So again, just like breath, that's why, breath work's so important around pain control and our perception of pain. And the other thing to note also is that, women's breath, due to their menstrual cycle, when they're in those reproductive years, the hormones impacts our breath work. So in that week before our period, our progesterone, one of our sex hormones, is going up, and that stimulates hyperventilation, and therefore you're blowing off more carbon dioxide, and therefore you're more prone to throw in a bit of stress and you hyperventilate even more. That carbon dioxide is going lower and lower, and that's why you have your issues around premenstrual syndrome, anxiety, perception of pain changes. And again, it's just being aware of that and realizing that, well, that's okay, but I've got a tool. Breath work can help me bring that down and help me control what I'm feeling. So just a couple of areas I think often get overlooked when we're thinking about breath.
It's a great couple of examples, because we can tie in and bring in some things of where people then can go to practice. We've talked about awareness, and where we can actually then take that. You've got some awareness of how you're breathing, and then starting to go, okay, I understand that faster breathing isn't good because I'm making myself more sensitive to carbon dioxide, which creates a snowball effect of then being more sensitive, so carry on breathing faster. The other and breathing faster, when we're the faster breathing rate will also stimulate that sympathetic tone, so we're feeling a little bit more stressed. What sort of posture do we go to when we are a bit stressed? We go to this flexion, we go to this forward head, shoulders rounded. That compromises our ability to posturally breathe well in terms of the function of the ribs, which we'll talk about. So it's multifaceted, and one of the things that tends to go hand in hand with that more stressful, faster breathing is mouth breathing, because the mouth is much larger hole than the nose, and that doesn't have as much, therefore, resistance. So it's when the body's like feeling stressed, it's like, right, I'm breathing faster because of all these things that's going on, and it's wanting to rev up because of how we're dealing with what's going on in our day, then we'll most likely shift to a mouth breathing pattern, which there's no protection for the airways. There's very little resistance, so it then facilitates a faster breathing rate, which again keeps you in this elevated state. So if we go practically, then how do we do something about that? The very nuts and bolts and the basics that everyone can benefit from is doing the opposite of like fast mouth, the sort of stress breathing is like relax. Rather than mouth, nose. The nose is designed for breathing, the mouth is designed for eating. 30 different functions of the nose, potentially even more, but 30 they've found so far that proves it's designed for breathing. So that resistance that the nose is going to provide to our breathing, because those two little holes are much smaller, means that your breathing's going to be slower. So all of a sudden we've gone from like a more relaxed breathing rather than being tense. We're slowing it down by breathing with the nose rather than breathing from the mouth. And the caveat or the twist to this is that, so that's good. But to start with, if you close your mouth and breathe in slower through your nose, or even just breathing in through your nose, it's gonna make you slow it down. Depending on what your breathing's been like, you might be like a bit uncomfortable with the feelings and sensations of slowing your breathing down. Why is that? Because as you slow your breathing down, you're not breathing out as much carbon dioxide. Your brain has become sensitive to carbon dioxide. So whilst you're trying to breathe slower with your nose, because that's what Jacko and Dr. Sally Bell's told you to do, initially, for some people, that will make you feel uncomfortable because you're getting these urges to breathe. So it's just a gradual process to work on, but just being conscious of how do you feel, and also where are you breathing from in terms of your mouth and your nose, and then what's the speed that you're breathing at. And at rest, one of the things I like to get people to practice, and just generally it should be like at rest, listen out for your breathing. So if you switch to nose breathing rather than breathing from the mouth, it's going to help to slow it down. But listen out for the noise. For you to breathe silently, or certainly quietly, then you have to breathe slower. You can't make noises whilst you're breathing. Same reason why breathing light before going to bed, so we don't snore. The only way we make noises when we're breathing is by breathing faster and more aggressive, and faster, more aggressive inhales is linked to that sympathetic tone of ramping up the nervous system. So trying to breathe slower, and the nose will help us do that, and then trying to breathe quietly will help facilitate, and oh, I have slowed it down. And there's a really nice feeling of being aware of your breathing, noticing that you've calmed it down, and with that sort of stillness, or the quietness you get, there is a stillness physically as well as mentally, because mentally, when you're thinking about your breathing, you're less distracted about all the other things that's going on.
You actually can't think about other things. It's really interesting. Your brain can't do both. So actually, one of the greatest things when your mind's racing is to do something, even counting your breaths, or your heartbeats, or because your brain hasn't got the capacity to do both. So it's a great trick. No, that's fab. And so, yeah, so I love that. I mean, it's so simple, isn't it?
Yeah. I think
listen. And then I think that's the wonderful quick fix, is that lovely feeling of stillness, which I think every single one of us is totally ravenous for, because life is so busy. And so it's just a wonderful tool. And I think also, Jacko, it's great because it's doing some amazing biochemical things in your body. But also I think body awareness is one of the things that it also helps. And the reason that we have symptoms in our body is because something's out of whack. It's the body's kind way of saying, hello, can you pay attention? And and we ignore it, or we medicate it at our peril. And actually, if we can start listening to that, and this is where breath has this dual capacity, not only to address some of the issues we're talking about at a root cause, but it's bringing us to be present, and actually be present to our own bodies and hear what we need to hear. But yeah, we're going to talk about the diaphragm.
Yes, no, I was going to say you want to go on to that. Just on that, like the present nurse or it's something that's there like anytime you want it. You can literally just go, okay, I'm just going to think about my breathing for the next 3 seconds. I don't care how long it is. Like it doesn't have it doesn't have to be this thing that you sit on a yoga mat like this. I'm all down for wearing a bandana and getting hippie, like I'm cool with that. But at the same time, that the solution is for you to be able to like be conscious and aware of your breathing on a base level.
And I think it's nice to tie it when you're starting this. So I often say, you know, just tie it into something you already do. You clean your teeth every day. So, you know, maybe think about breathing through your nose as you're cleaning. You know, you boil the kettle how many times? So 3 minutes it takes to boil the kettle. Oh my goodness, your breath work will take you to, you know, it will take you to heaven and back late in 3 minutes. And so actually sometimes, you know, we can think, oh yeah, I'll do it. But to hook it into something we already do, I think is a real key, you know. So you'll never have to tell me to make coffee in the morning. And so for me, my thing recently, because I'm trying to work on breathing and speaking, because I've noticed I end up doing this and I get really passionate and then I'm not breathing, and then I end up with a strained voice. And I'm just, part of my, you know, development at the moment is you know is this kind of breath and talking, but actually hooking these ideas into everyday things is the key to any change, you know.
The brushing the teeth is a great one, because I haven't even actually tried this, but I know that. So someone mentioned, someone was talking to someone, I think it was when I was doing, someone said that they, to make themselves, I think maybe they're on a watt bike or something. They were like, I put some water in my mouth, and then that, and I have to keep that in for the set that I was doing. So I have to nasal breathe, because like when you're drinking, you can't breathe in. Imagine when you're brushing your teeth, you can't breathe through your mouth. And not only is it good in terms of habit forming, finding scenarios or things that you do will actually basically you already breathe through your nose doing it. Is a great one. The talking is a good one. Just quickly on that, just because when we're getting excited, I'm saying we get excited because we're talking about this thing, so everything starts going faster. When everything's going faster, the heart rate's speeding up. We're getting this whole like stress response, but not in a bad way, in a good way. Like you said, stress doesn't have to be bad. But what is speech in terms of breathing? Is it breathing in, or is speech breathing out? You try to talk on an inhale. Hello. So talking is purely breathing out. So if we're doing lots of fast talking, we're doing lots of breathing out, and it's the same as blowing off that CO2. So yeah, trying to that's another big one. That's actually another big one for me as well. But we have the awareness, like I said, for everyone. We've got awareness, and then it's just okay. Slow it down, take some pauses. Because there'll be plenty of people that for their job do a lot of either on the phone or do a lot of presenting, and they'll have the similar sort of thing. You feel exhausted at the end of the day because you've been doing all of this talking, which is challenging for in terms of a skill for the body anyway, but also, you know, effectively, you're just over breathing all day if you're doing lots of fast talking.
Well, that means you've been in the stress zone all day, and therefore that's had all of those, you know, biochemical things going on like we talked about. So it's because I think some people just think, oh, it's stressed, just want to just feel overwhelmed, or it's not. The stress response actually is to all sorts. It's to the ping on your phone, it's to the email, it's as well as the argument and the deadline, and it's, I think, in modern day life, you know, that so much is kicking off this stress response, and if we don't learn what it feels like, and we don't learn how to recognize mouth breathing, noisy breathing, chests going up, if we can't work out what that feels like in our body, we miss the opportunity of closing those cycles. And breath is just a way to close that cycle and move us back into that harmonious balance that our body needs to be the best that it can.
Diaphragm then. So
what's the diaphragm, before we just assume that everybody knows?
So the diaphragm is fascinating muscle. It's one of those muscles that I think of like the tongue. You know, like you often think that, oh, it's like, oh, that's a muscle. Yeah, it's a muscle. So it's our diaphragms are our primary breathing muscle. Its job is on an inhale to come down and flatten out, which helps pull air in as it's driving down, so that we don't have to lift the rib cage. You know, if you've got really tight neck and shoulders and pecs because you're using those muscles all the time for your breathing, chances are you've switched to nasal breathing and start to think about breathing from lower down with your diaphragm. It can actually release a lot of that tension, which some of the tension through here can lead to like headaches. So if someone's struggling,
migraines and jaw issues.
Some of that can be, you know, breathing isn't a cure-all for everything, but it can help relieve that, or it can be part of the puzzle for that. So when we inhale, the diaphragm's moving down and flattening out. And in order to do this, we need to allow the ribs to move out to create a space for the diaphragm to move down. So,
and it's sitting right under your ribs there, isn't it? If people don't know where it is.
So
look at you.
Look with my jumper, I can try and show you my. It's a bit cold. I'm not going to take the shirt off today, so it's a bit cold in there. It's a family show. Look, there's like my rib on my right hand side. There's my rib on the left hand side. So the bottom of our rib cage is sat like this. Those two lowest ribs. The diaphragm attaches on the front to those ribs, and then at the back attaches onto the lumbar spine. And interestingly, it's not just one muscle. There's two like hemispheres. So we think of it as being this like dome shape. But the right hand hemisphere is slightly bigger than the left, because on the inside of us, and you'll do a better job of this than me, but on the inside of us, even though I look symmetrical, look, I've got my arms and my legs and everything's symmetrical. On the inside, I don't have two hearts. Like I have two lungs, but I don't have two livers. So inside, everything's a little bit
asymmetrical.
Yeah, asymmetrical. That's better than unsymmetrical, isn't it? And so we have this diaphragm on the right side is slightly bigger. So a lot of the time, people find it easier to inflate on the right compared to the left. That's something nice to be sort of aware of. But for most people, we're literally talking about the fact that if we put one hand below where those two lower ribs meet and one hand above, and if you take a normal breath in through your nose, a lot of people will notice that rather than this bottom hand thinking about moving because the diaphragm's moving down and it's situated under there, we get this shoulder movement up, and we'll feel a lot of movement coming from the chest and the upper hand.
Yeah.
So
you often, don't you, when you ask somebody to take a deep breath, they go, and you're like, oh no, not like that.
Exactly. And because when we say deep breath, one does they're basically fast, big breath and vertical. Well, actually, what we want is we want to be breathing slower, and we want rather than fast. We want to be breathing from lower down rather than high. And actually, we want these ribs moving out, so it's more of a horizontal movement than a vertical movement. And so, in order to create the space for this diaphragm that's situated where those ribs are to move down and flatten out on the inhale, these ribs on an inhale need to widen. And on the inhale, so we create this space, the diaphragm comes down 1 or 2 centimeters, and then on the exhale, so as we breathe out, those ribs want to come back in together. So there's a few muscles at play, like any movement. It's a movement pattern. So think of like in a squat, there's your hamstrings, your glutes, your hip flexors, all these things have to work in a nice cycle and work together. In order for your diaphragm to be able to move, the ribs need to get out of the way or create the space for that to happen. So we've got all the musculature around our intercostals, our internal, external obliques, and abdominal muscles have to allow the ribs to widen on the inhale, and they have to help pull the ribs in together on the exhale to get the diaphragm to go back up to that resting position. A lot of people initially will struggle with the inhale, but they'll also struggle with the exhale, that the ribs will stay out. And if the ribs are staying out, you're not bringing them together and flattening them down towards the pelvis on our exhale, then because if the diaphragm attaches onto the ribs, if the ribs are out and flared, then the diaphragm is being pulled and stretched. So he's not happy, or she's not happy, whether your diaphragm's male or female, but it's not happy keeping tension onto it, and that will affect, think it attaches onto your lumbar spine, so that'll affect your lower back. where it attaches to the lumbar spine. We've got the QL and we've got psoas major. So it's having an effect on the hips as well. So there can be some physical things going on in that respect. But I think the other thing that's really interesting about the diaphragm movement is the effect that we've got on some of those internal organs going on. So that we've got the heart above, where the diaphragm, when it comes back up to its rest position, we've got you know, those internal organs below. That's going to get a bit of a massage as we get this nice movement of the diaphragm.
And that works with your pelvic floor as well. You know, they're all working together. And I just to pick up, like, I mean, my experience of this, being new to it over the last sort of year or so, is people think we're telling them that's how they breathe, and it's like, no, this is how we need to breathe. And actually, for a lot of people, you know, using your lower ribs and actually learning to engage your diaphragm is something to be learned again. And so I think, you know, if people are finding it hard and they're just like, well, I can't stop don't worry. You're with so many people, and like, I just find dysfunctional breathing in so many of my clients now. And so don't beat yourself up. Like, this is what you do. You're teaching people what it feels like to move your diaphragm, you know, and to move those lower ribs. And that it needs some training. It is a muscle, and if it hasn't been used, you know, for a long time on a regular basis, you know, you lose that memory. And so, you know, not to let people beat themselves up. And I just want to make mention of a story again of a client we've both worked with this whole thing about diaphragm and gut health. So this lady had irretractable acid problems, and for 10 years, and she'd had every scan under the sun, on long-term medication, and really the conventional medics have shoved her on the shelf if there's nothing else we can do, and you have to live with it. And it really was having an awful effect. And then, you know, and when I sat and watched her in clinic, she'd had an incredibly stressful 10 years. And I watched, and it was like, oh my goodness, her core and her abs were all locked on, her ribs were locked down, and she was almost slightly stooped forward, and she just wasn't moving her diaphragm. Now, if you think your stomach goes through the diaphragm, your abs squeeze up, and all was happening is that acid was just going up her esophagus. And what we needed to do is open out her front body, you know, help her use those lower ribs, help her diaphragm just, you know, relax and move. And before we did anything else, any other fancy diets or what have you. And that was probably one of the first patients I sent to you. And when I reviewed her in clinic a few months ago, she was close to tears, and she said, Sally, your team has given me my life back. And I just and so again, just realizing it's so much more in terms of, yes, those internal organs. And so, yeah, just to advocate that you know, using that diaphragm and using it appropriately has so many more effects than just, you know, breath and relaxing and calming. There are a whole lot of organs under there that are connected, and we need that kind of integrated approach to resolve it. And we talked a little bit earlier about the pelvic floor working together, you know, with the diaphragm. Pelvic floor often damaged can be damaged through childbirth, and we're often told, you know, as women, you know, when it comes to repairing pelvic floor, that we just have to concentrate on our pelvic floor exercises. And it's been a revelation to me to actually think, oh no, we need to look at the whole system, because if the diaphragm's not working, what's the point of me asking them to do pelvic floor exercises? And you know, and the pelvic floor pain actually might be because this isn't working up here. So again, this sort of integrated approach of, okay, pelvic floor, but what's happening with the diaphragm? What's happening with those muscles around? Has you know, extends beyond, you know, just this idea of breath work and being calm. And wow, this is a tool another tool that we might be able to use to help people resolve those chronic pain issues around the pelvis.
Yeah, and as we sort of we've said this to each other a few times around, it's so accessible, like it's free, it's happening all the time.
Mm.
with a little, hopefully with being just listening to this conversation, you've got a better understanding of like how
Mm.
you can breathe better to improve your overall health and everything that's going on in the background. And it's one of those things within like health and fitness for me that I've had a bit of a realization of going like, but it's one of those things that you can't say, but it's not for me. Like,
Yeah.
I'm just going to carry on breathing badly. Like, it probably won't do anything for me. Whereas there's lots of other things, there's lots of things within health and fitness and well-being that you go, this could be good to go. This could be good for some people. This can be good for lots of people. But it's sort of like, well, find the things that work for you. You can't dismiss, well, you can choose to dismiss it, but you're just leaving something behind that's going to be a great tool for you. If you dismiss the way that you're breathing,
Yeah.
isn't going to impact you. Hopefully, Sally, you've done a wonderful job there of like giving us an insight of like how it can affect all these different areas. Lovely examples from a couple of patients that are noticing some differences.
And that thing like that you've just said is that we think, oh, we'll do this diet and we'll do this exercise regime, and we spend a huge, millions, billions of pounds as a nation on all these things, where actually your gut's not going to function if you're not breathing right. Actually, you're not going to get the muscle recovery or being able to perform if you don't get your breathing right. Or that psychotherapy, it's like, well, that's great, but we need to get your gut and your breath work in order for that.
We're
And
going to
so
have that break on that I talked
it is, and it's just like, actually, yeah, great, we want people to do all these things and find their thing that works for their life, but it is what holds and sort of cements it together. So maybe it's not a foundation, it's the cement.
Yeah, there you go, between the bricks.
So no, that's fabulous. So just tell me, I don't know whether you want to talk any more about this, but I was going to say it'd be great to know for people how to connect with you and what you're doing. And what you're up to at the moment.
Yeah. So I say, Sally's already said that we work together with some of your patients and clients. I have obviously some of my own one-on-one stuff tends to be people. I work obviously with anyone that's interested in improving their breathing to improve the way they feel, move, and perform is what I say. So a lot of the time it can be with people that are interested in sports. From my background, I used to play professional rugby, and this is one of the things where I'm like, man, I was fit when I played, but I knew nothing about breathing. I wish I knew this back when I played. So I worked with some professional rugby players and teams, and that sort of scratches a little bit of an itch for me to stay within the sporting world. But I've got some online courses, and I've got a free ebook for people that want to get just nailed down on some of the basics. So 3 steps to better breathing. That's on the website rootedlife.co.uk, or me on Instagram. My personal account is Jacko Human Flag. So you'll find lots of stuff on there, or my YouTube is just David Jackson. So yeah, if you're interested in finding a little bit more out, but hopefully you've got a lot of information here that you can put into practice.
No, that's great. And then for me, so my website is drsallybell.com, and yes, have clinic. I tend to focus more on women's health, but I still have lots of men sort of sneak under. I find it very difficult to say no. If people want a solution, a personalized approach to health, that more integrated approach, thinking root cause more than just treating symptoms, I'm your doctor for that. And interestingly, within my team there's David, but we have a psychotherapist and health coach, and your wife's a health coach, and so it's a very sort of integrated team looking at really trying to help you and make the changes and support you in the changes that you want to make so you can flourish. Also developing some online courses. These will be just for women. You don't want to be going on those, men. So and then I speak at different events, mainly about food. I'm massively passionate about farming and real food. So you'll often hear me on the BBC talking about that and banging my drum. But it's been a joy, and I certainly hope people find this super helpful, and I can't advocate enough for what you do, David. I just have so many people not only tell me how wonderful you are, but also the things that you're teaching is great. So yes,
As
so
I said, they teach me, and just my final sign off is to say that I can't recommend Sally enough. But and this is based upon my father got diagnosed with prostate cancer earlier this year, and the first person I got in to book him with was Sally. So because I'd even trust my father's help with you, and so massive thank you for that. But hopefully that gives people a bit of idea about the level of confidence that I have.
Yeah, great. Well, fabulous. Thank you.
Yeah, thanks for watching, and thanks for joining, Sally. We'll see you all again soon.